Hi, I want to say thank you for inviting me to speak. I'll just share a little bit about who I am and what I'm learning. So, my name is Anna Sokol. I'm Anne in English, and I'm an American, and I always wanted to live in Ukraine since I was about 18 years old. I'm now 47 years old. I moved to Ukraine in 2002, and I married my Ukrainian husband, Vitaly, in 2004. And I've lived in Ukraine for 20 years. So we have four children, and the first one was born in America because I just wanted to have a birth in my own culture, and then the other three were born in Ukraine. My husband right now is actually in Ukraine with our oldest daughter, enrolling her in university there. Right now, I am in the Philippines, and I'm in an American program where I'm studying to be a home birth midwife under the guidelines of what they require in the United States. It's different in every country. And in America, they have, I think, two or three types of midwives. And the most common two types of midwives in America are midwives who go through the 4-year nurses degree, bachelor's degree. They become nurses, and then they get a master's degree in midwifery, and then they become what's called certified nurse midwives. I'm going through a program where I'm becoming a certified professional midwife, which is a midwife who works in the home center or in a birth center, which is just like outside of the hospital or attached to a hospital. So, um, so I will talk a little bit about the learning to do gynecological care. So, as part of my program, we are required to learn how to do well woman care. So, we can take the full medical history of the woman. We can do a well woman exam. We can also do the physical exam of the uterus, ovaries, and the structure, the cervix. And then we also are trained to do the pap smears, where you put in the speculum and you take a sample from the cervix, and then you skin sample of the cells, and then you rub it on the slide and you send it off to a laboratory. We also do the gram stain, which tests for any type of infection or sexually transmitted diseases, where you put in again the brush and you get all of the discharges, and then you wipe it on the slide and send it off to the laboratory. So as part of my training as a certified professional midwife, we're required to learn to do full well woman care. As far as family planning goes, we are mostly required to be able to counsel her, to take all of her history about family planning and to help her come to an understanding of what she might need. And then we can prescribe or help her get what she needs as far as family planning goes. And there are, for example, I'm in the Philippines right now, and the Filipina midwives, they basically do all of the family planning. They can give the hormonal pills, or they can give the depot shots, or they can do the implanton into the upper inside arm. This is what the midwives do, or the insert the IUDs. So here in the Philippines, midwives do a lot of that, and in America, it's also what they can do, or it's just a lot of it just depends on the hospital where you work, or what is needed in the place that you work as a midwife. But you're able to do all of that full range of care. We call it well woman care. It's just a woman who is outside of pregnancy. So that is what we are trained to do as midwives. And I'm also sending my current just teaching and overview about family planning. I'll just send my PowerPoint. And I'm living in a place right now. The Philippines is a Catholic country. There's no abortions here. And so the government really emphasizes family planning methods, especially the long term ones like the hormonal ones, or even sterilization if people want that after they've had several children. So it's kind of like the family planning is kind of a big deal here. I do want to say that I've found that as a mother and as a woman and a midwife, it's different. You know, we read in these textbooks about statistics and like these family planning statistics, and you should use this method or that method, or knowing all of the contraindications. But really, when you're talking to women, they are having to make a personal decision, a very personal decision for each person. And to them, it's not statistics or a textbook. It's something that they have to decide for themselves with their partner. So I try to address it on a personal level. And I will send my slides that I use when I teach this topic in our birth center. Currently, it might be, I would probably share a little bit differently if I were just sharing one-on-one with somebody, but it is something that when we do the postpartum checks of the mother and the baby, where we do ask and follow up with them about what type of family planning they would like to use. And so that is a regular routine part of the care that we as midwives offer women. So I just want to also, I just want to encourage you and say thank you so much for being a midwife and for all the wonderful work that you're doing for families in Ukraine. And I just want to share that I've lived in Ukraine for 20 years and I love it there. I have been so upset about the war and everything that's going on there. And so we pray for Ukraine, and we are helping and supporting in the ways that we can while we're away. We're just away so that I can study. And then, Lord willing, we'll be coming back. I will just share a little bit I was asked to talk a little bit about why I chose to become a midwife when I'm already old. So I just feel in my own life, it's just a calling that the Lord gave me since I was a young teenager. I just have had this fascination with birth and really just learning to love women who are having babies. And the Lord just gave me this as a burden to walk with women and families during this time of their life when they are pregnant and having children. And so that's why I'm finally able to pursue this, because my own 4 children are kind of old enough now. So that's why I'm doing it right now. And I just want to say how much I appreciate your work and everything that you're doing there and doing for Ukraine. And may God bless you. Thank you.